Thank you, Professor Vijayakumar and the team for the nice organization of 3D program. And this is the, I think I've been in this, involved in this for the last so many years without fail. I thought that I may not be able to join today's meeting because of some personal issues, but still God was great so that I'm able to come and talk to you. Thank you, Chairperson, for the kind words of introduction. I think Dr. Meenakshi has set the stage for the carbohydrate content that an average Indian consumes. So in this context, I think I will be talking little more on what can happen if you can lower the carbohydrate, and what are the ways and how will you try to distinguish between the low carbohydrate diet versus very low carbohydrate diet. So if you are looking at the American standards, that if you are looking at the acceptable macronutrition distribution range, I think the carbohydrate that is being allowed is some for average American is between 45 to 65%, which is not even in Indian standards are almost applicable, but you can see that in the Indian data, especially with what Meenakshi Bajaj had shown you, pan-India, the average consumption is almost touching 80% plus. It's just not that South Indians, we eat more carbohydrate, whether I think pan-India we are seeing it much worse than the American supposed to take. So if you are looking at the National Academy of Sciences, recommendation is of carbohydrates approximately around 130 grams. When it comes to low carbohydrate diet, the LCD, it's in a gray area. There is no great clarification when it comes to the literature search which I have done in the last 24 hours. I found that in majority of the literature, LCD is described that one having less than 45% of the total energy intake in the form of the carbohydrate as the macronutrient. But in some, it tells us that it is as less as 26%. So there are some variation in it. But one thing that is very simple to know is that if you can reduce your carbohydrate intake to less than 130 grams, it comes into the classification, general classification as low calorie, low carbohydrate diet. And when you talk about the low carbohydrate diet, what else can be is being replaced? If you look at that, I think mostly it is going to be the fat that is being replaced for the carbohydrate. So probably in some literature you can see that low carbohydrate diet is also being taken as a low carbohydrate high fat diet, or LCHF. And these are the different strategies where we can try to probably, I think you would have heard yesterday regarding the remission of type 2 diabetes. Here we are trying to do a lifestyle modification where diet makes a very important part to play, where we have the strategies, either you concentrate on the calorie or you concentrate on the macronutrient. In the calorie reduction, you have the calorie that will be restricted to 15 to 40%. We have intermittent fasting, we have time restricted fasting, as well as we are looking at the carbohydrate. We are talking about the low calorie or the very low calorie diet, especially the ketogenic diet. So when you're talking about the very low carbohydrate diet, there is something that is consistent. It is not like the low calorie diet. Very low calorie diet says very clear that if you can take less than 10% of the carbohydrate intake from the energy, it becomes a very low calorie diet. And when you talk about the carbohydrate content, it should be less than 50 gram. 130 and low will be low calorie, low carbohydrate diet, whereas VLCD, it is less than 50 gram per day. So this produces a nutritional ketosis. So the ketogenic diet, which I think my speaker was supposed to talk, so that's why I have left out a lot of slides. It's a very low in carbohydrate and moderate or adequate in protein, translating into a carbohydrate level less than 50 grams per day and a protein between 1.2 to 2 grams per kilogram for adjusted body weight. And there is another way of looking at the whole scenario. We're looking at the carb calorie model, where the percentage remains constant. So in when very low calorie carbohydrate ketogenic diet, it is less than 10% will be carbohydrate. LCD will be somewhere between 10 to 20%, and the moderate carbohydrate diet will be 26 to 45%, and high carbohydrate diet is going to be more than 45%. But in India, what is happening? We are almost doubling. It's almost 80% plus. What is the role of carbohydrate in obesity and type 2 diabetes? I don't want to talk too much on the mechanistics of it. for the want of time, but the benefits of LCD, the metabolic and the hormonal responses to a low carbohydrate diet are associated with less oxidative stress and inflammatory response after meal, and as well as the improvement in the features of the insulin resistance and the metabolic syndrome. Individuals who are insulin sensitive tend to respond well to either a low fat or a low carbohydrate diet, because that it manages the insulin resistance much better. So what are the benefits if for a diabetic put on a low carbohydrate diet? If you are looking at this particular study, based on a survey of adults on a low carbohydrate eating pattern, there was a reduction in all the parameters that we are talking about, especially of the metabolic health. The low carbohydrate diet induces favorable changes in cholesterol and other CVD risk markers, and including the whatever may be the associated insulin resistance phenotypes, which includes high triglyceride, low HDL, small dense LDL, high blood sugar, hyperinsulinemia, hypertension, as well as chronic inflammation. When we talk about VLCD, all of us know that the nutritional ketosis plays an important role, which requires less than 50 grams of carbohydrate, and it may range between 30 to 70 depending upon the body weight. So if you are looking at the ketogenic diet, it is depending on the individual and the degree of the carbohydrate restriction. The approximate daily carbohydrate allotment in terms of the food sources is probably, this is one prototype I am giving to you. It is 5 to 10 gram from protein based diets, which includes eggs, cheese and the fish products or the seafood products, 10 to 15 gram from non-starchy vegetables, 5 to 10 grams from seeds, nuts and seeds, and 5 to 10 grams from fleshy fruits, which includes berries, olives, tomatoes and avocados. We have to be a little careful with avocados though, because they are rich in fat. And 5 to 10 grams from miscellaneous sources from low carb desserts and high fat dressings, which has very minimal amount of sugars. So if you are looking, this is the last part of my talk, because I am going to dwell little on this current thing. What had happened is the direct trial. If you are looking at the direct trial, which is being done by the primary physicians in UK, and it happened 5 years back, and you could look at that. If the patients have been put on, the famous quote is that's called the shakes and soups diet, which had about around 800 calories per day in 3 to 5 months, and you can see that the more the weight loss, there was a remission of diabetes. When they had more than 15% of 15 kilos of weight loss, I think almost 86% remission. There was a remission in diabetes, and it was sustained after 1 year. So what now we know is that there is a new data just emerged about a couple of days back. From the original data, which was actually direct data, was 2 years back. All these patients most of the patients were followed up, and we could see that initially almost half of the people with type 2 diabetes who received the weight management program were in remission in a year, and 36% since 2 years. And this extension part, when I'm talking the extension, the last 3 years, they were observed 95% participants from the original intervention group received the same weight management program, and it was continued with support. They were given, when there was a weight increase by 2 kilos, they were again put back on the soup and shake diet. And you could see that, and after 4 weeks, they were reintroduced to normal feeds. And this is the particular, the paper clipping that came in Times 3 days back. So the soup and shake diet can reverse type 2 diabetes. So this is the importance of giving the patients, and this was followed. We were talking about the durability. That was a big question, whether VLCD diet is durable. But now we have the data from direct trial, which says that 85 participants from the original intervention revealed an average 5-year weight loss of 6.1 kilos. 48 people from the original interventional group were in remission at the start of the 3-year extension program study. 11 of these, 23%, were still in remission at 5 years, and their average weight loss was 8.9 compared to 4.6 in the comparison group. That tells you the benefits of, if we are able to sustain. Ultimately, the satiety matters. So if we can improve the behavioral modulation continues, and patient starts enjoying the weight loss, and you can see that patient probably also gets a much better metabolic health, which can lead to remission of type 2 diabetes. Thank you for your patient listening.